I also would like to first thank our many community partners and city and county colleagues, many of whom I see here today. We truly could not have competed successfully without your invaluable assistance. Project Renew addresses one of the most significant public health threats that we face, that of the obesity epidemic and the related problems of physical inactivity and poor nutrition. I'm not going to repeat the statistics that have already been mentioned, but I just want to highlight one, the fact that 1 in 4 children in this county is obese, and that is 4 times higher than what we saw only a generation ago. So what explains that dramatic increase? Certainly, as Dr. Fielding mentioned, the environments in which we live play a major role. Environments, for example, where families and children have little access to affordable, healthy foods and few options for outdoor activities. Project Renew seeks to change these environmental conditions in ways that will make it easier for children and adults to be physically active, eat more healthfully, and maintain a healthy body weight. The LA County Department of Public Health will work with community, school, city, and county partners to implement a range of strategies over the course of the next 2 years. These strategies will include working with schools to improve the nutritional content of school meals, working with preschool providers to implement nutrition and physical activity standards, and educating parents so that young children can be better protected from developing early obesity. Expanding physical education in schools and opportunities for physical activity in after-school programs. Creating more opportunities for walking and biking in communities by supporting the development of expanded bike networks, promoting their use, and working with city and county planners to create more pedestrian-friendly communities. Establishing joint use agreements between schools and community groups to utilize school grounds and facilities for recreational programs during non-school hours, particularly in disadvantaged communities with few parks or other recreational venues. Promoting healthy food and beverage policies in city and county programs serving youth and other vulnerable populations. Working with local grocers and markets to increase healthy food offerings. Establishing breastfeeding-friendly policies in hospitals and in workplaces. Implementing a social marketing and public education campaign to promote healthy eating and discourage consumption of soda and other sugar-sweetened beverages, a major contributor to the obesity epidemic. The success of these efforts will depend on our ability to reach key decision makers outside the traditional healthcare arena. For example, city land use and transportation planners, school officials, elected representatives, food retailers, and others in the business community. In addition, our success will depend in large part on our ability to engage communities and generate grassroots support for policies and environmental changes needed to promote healthy eating and active living. We are greatly looking forward to the important and challenging work that lies ahead with our many partners across the county and state. I'd now like to introduce Linda Aragon, Director of our Tobacco Control and Prevention Program, who will describe Project Trust. Thank you.
Of course, I have to go behind